There are a number of aspects to consider when designing a telemedicine exam room. The most important are room location, room size, equipment and furniture placement, lighting, acoustics, and wall color. Since most patient sites will be adapting an existing room for telemedicine, it will be important to find the best possible fit and to budget for necessary room modifications. While much of this information is applicable to general video conferencing, this video focuses on patient examination rooms. Room location. The telemedicine room should be in a quiet location, minimizing exposure to office noise, busy corridors, stairwells, parking lots, waiting rooms, restrooms, or other sources of noise. Such noise can be picked up by telemedicine microphones, which can make it difficult for the remote site to hear. Rooms without windows are better for quality image transmission. Rooms with windows should have shades or blinds to control the light. The room size needed depends on the service being provided and the type and size of the equipment being used. For example, clinical or patient education programs will require conference seating for many participants, while specialty services will require examination tables and room for only a few people. A telemedicine exam room should be large enough to accommodate an examination table, a couple of chairs, and the telemedicine equipment. Most exam rooms should also contain a work surface for charting, a phone, a computer, and when necessary, a fax machine. There should be adequate room for the patient to sit in a chair or use the examination table. And there should be ample room for staff to comfortably move around the room during a patient visit. The dimensions of the room are also important because the distance between walls will dictate the proximity of the camera and microphone to the patient. The telemedicine camera should be located a minimum of 6 to 8 feet from the patient. A small room forces the camera to be located too close to the patient, limiting the consultant's view. Equipment placement. Once an appropriate room has been located, it will need to be evaluated for placement of the telemedicine and other equipment. The goal of placement is to optimize the camera's view of the patient, to allow staff to enter and exit without interrupting the visit, and also to allow the presenter to easily use the scopes and peripherals. Making a drawing of the room with doors, windows, electrical outlets, and telecommunication connections can be very helpful as you begin to consider placement of equipment. The camera and exam table should be positioned so the clinical presenter can see both the patient and the monitor when using scopes that transmit images to the remote provider site. The exam table or chair should not be placed in front of a window because backlighting can degrade the patient image at the remote clinician site. The placement of the telemedicine unit should also not result in glare on the monitor. Lastly, there will need to be an adequate number of electrical outlets for the unit and scopes, and the ability to place the telecommunication lines close to the telemedicine unit. Lighting requirements. Lighting is perhaps the most critical factor in designing a telemedicine examination room. Lighting impacts the clinician's ability to see the patient clearly and with true color reproduction, both of which are critical for patient evaluation. The telemedicine exam room is essentially a mini television studio, and the same lighting principles apply. Ideally, your room will have adequate direct and indirect lighting. A good direct light source with diffused light should be located in front of the patient and should shine diagonally toward the patient. This will provide the light necessary to reduce facial shadows and optimize accurate color transmission. Avoid harsh lighting that shines directly in the patient's eyes. Overhead fluorescent lights, often found in patient exam rooms, may not support accurate color transmission and could be replaced with full spectrum tubes. Overhead lighting alone will not create optimal lighting. Keep in mind that your camera, no matter how current or expensive, cannot make up for or correct poor lighting. Good lighting, on the other hand, can dramatically improve image transmission even when using less expensive cameras. Room color guidelines. Wall color also impacts how patients look on video. White walls can appear to darken faces, making features hard to see at the remote site. A blue or light gray background works well on all skin tones. Use flat paint to avoid any reflection off the wall. Acoustic requirements. Good acoustic design is also a component of telemedicine room design. Rooms that echo, however slight, make conversation between the patient and remote clinician difficult. High ceilings and hard surfaces on floors and walls can create poor acoustics, as can noises from facility mechanics and external sources. Sound damping should be installed to reduce noise and echoes. Since a clinic setting does not lend itself to carpeting, acoustic tiles can be installed on the ceiling or around the top of the walls. Sound dampening wall paint is also available. Be sure to check on any facility licensing requirements before selecting a sound dampening solution. The last thing to consider is to keep the room clean and uncluttered. The camera will attempt to focus on everything in the focal range. If that includes bookshelves, posters, papers, and other things, the camera will focus on all of it, which can degrade the image of the patient. An uncluttered background optimizes camera function and improves the view by the remote site clinician.